Hi, my name is Phillipa. I'm a clinical nurse manager 3 in a large hospital here in Ireland. I work as part of a team in Medical 1 and Medical 2. Recently, I was asked to lead out in a project to improve patient flow and discharge to the community. The core need was to get people home from the hospital and support this by ensuring the care pathway with the community-based services was in place. Initially, I thought, where do I get started with this change? I met a colleague for coffee and they showed me the HSE resource on change called Creating the Conditions for Change and Integration. Needless to say, I read it from start to finish and it helped me with that first question, and indeed a lot of the others that came up along the way. The first thing that struck me about the guide was the sentence, working with people to deliver change. This really made me think, who else needs to be involved in this project? My immediate thoughts went to the hospital, thinking about colleagues who could help, the patient liaison team, and then I started to think about the Fair Deal office and the community. It was at this stage that I thought there are a lot more stakeholders actually. The primary care team would be key, and that meant a lot more services to be coordinated. I do remember feeling a little bit overwhelmed at that point, and I went back to the Creating Conditions for Change as I had spotted something on the health services being complex. And there it was, the best advice ever. Use 3 simple rules when change is complex. The guide recommends agreeing shared purpose, focusing on relationships, and using appropriate interventions. The last one was something we do all the time in terms of care decisions, but the first 2 got me thinking, who do I know in the community? I reached out to an OT friend of mine and she put me in touch with the primary care manager. I met David a week later and we talked through the project and looked at our shared purpose and providing care and looking at the current pathway from our hospital back to the community. I talked through the challenges we have around timely, appropriate discharge, and David began to map out what services are available for older patients when we need them. I remember the guide saying, connect, collaborate and convene. And David and I agreed to pull a working group together from across our hospital and the primary care services. And David also invited the Assistant Director of Nursing for Older Person Services to join. Our aim was to create an integrated virtual team to triage priority cases for discharge and how they could be supported in that transition by primary care and older person services. When we brought everyone together, David and I co-facilitated a session on shared purpose because I had seen that in the guide and used some of the templates in the resource to have conversations in the working group around what readiness factors were needed to create the virtual integrated team. After 8 weeks of preparing the supports around the clinical governance, assessment integrated care pathway needs, identifying a pilot patient demographic, and membership of the virtual team, we began holding a meeting every Tuesday morning to triage the patients based on readiness for discharge and what was needed in terms of community supports to enable that. We've been operating the virtual integrated team for 2 months now and it has been a tremendous impact. The people we care for are getting home much sooner and both they and their families feel confident that the community supports are in place to enable that. We aim to widen the scope of our patients involved in time. And for me, having the Creating the Conditions and Change integration resource was so timely. And it answered so many of my questions as we journeyed on this project. I would highly recommend anybody supporting new ways of working in change to check it out.